Top 25 EMT Interview Questions and Answers. Welcome back to the channel. In today's video, we're diving into the top 25 EMT interview questions and answers to help you prepare confidently for your upcoming emergency medical technician interview. Whether you're a fresh graduate or transitioning into EMS, these questions will guide you in showcasing your clinical knowledge, communication skills, teamwork abilities, and quick decision-making mindset. So grab a notebook, stay focused, and let's make sure you walk into your interview prepared and ready to impress. 1. Tell us about yourself. I'm an enthusiastic and dedicated EMT candidate with a strong commitment to helping others in emergency situations. I completed my EMT training with hands-on clinical rotations that strengthened my skills in patient assessment, CPR, trauma care, and safe ambulance operations. I'm a calm, organized, and fast-thinking individual who performs well under pressure. I enjoy teamwork and believe communication is key to successful emergency response. My goal is to deliver compassionate care, maintain patient safety, and represent the EMS department professionally while continuing to grow my skills in real-world emergency scenarios. 2. Why do you want to become an EMT? I want to become an EMT because I'm driven by a strong desire to make a meaningful difference in critical moments. I believe emergency medical services offer a unique blend of medical skill, rapid decision-making, and compassion. I'm motivated by the opportunity to help people during their most vulnerable times and provide reassurance when they need it most. Being an EMT also allows me to build a strong foundation for my long-term career in healthcare while serving my community with integrity, responsibility, and empathy. 3. What qualities make you a good EMT? I bring several qualities essential for EMS success, including calmness under pressure, strong communication skills, and quick critical thinking abilities. I'm physically fit, mentally resilient, and capable of handling stressful situations professionally. I value teamwork and understand the importance of clear communication with partners, patients, and hospital staff. Compassion is also a key part of my approach. I always treat patients with dignity and respect. Additionally, I'm detail-oriented, safety-focused, and committed to following established protocols to ensure accurate assessments and effective care. 4. How do you handle stressful or high-pressure situations? In high-pressure situations, I stay focused by remaining calm and following established protocols. I prioritize tasks, communicate clearly with my partner, and reassess the situation as needed. I rely on my training to guide my decisions and avoid reacting emotionally. I also stay aware of my environment to maintain safety for myself, my team, and the patient. After each call, I take a moment to debrief, process the event, and identify improvements. This mindset helps me maintain emotional balance while consistently delivering high-quality patient care. 5. Describe a time you had to make a quick decision. In my EMT training, I encountered a situation during a simulation where the patient's breathing suddenly deteriorated. I had to quickly reassess, check airway patency, reposition the head, and begin assisted ventilations. I communicated clearly with my team and assigned tasks to ensure efficiency. My quick decision prevented further decline and stabilized the scenario. This experience taught me the importance of staying focused, assessing rapidly, and trusting my training in time-sensitive emergencies. It reinforced my ability to remain calm and decisive under pressure. 6. How do you ensure patient confidentiality? I follow HIPAA guidelines and department policies to protect patient privacy at all times. I never discuss patient information outside of professional settings, and I share details only with authorized personnel involved in the patient's care. I avoid using identifying information in casual conversations and ensure reports are stored properly. During transport, I speak discreetly and avoid unnecessary public discussions. I also protect written documents and electronic records. Maintaining confidentiality builds trust, ensures legal compliance, and upholds professional ethics. 7. How do you handle a patient who refuses treatment? When a patient refuses treatment, I first ensure they are alert, oriented, and capable of making an informed decision. I explain the risks and benefits clearly, using simple and respectful communication. I also assess whether refusal stems from fear, confusion, or misunderstanding and try to address concerns. If the patient still refuses, I document the interaction thoroughly, obtain signatures when possible, and notify medical control if required. My goal is to respect patient autonomy while ensuring they make informed choices. 8. What steps do you take when assessing a trauma patient? I follow a structured trauma assessment starting with scene safety and body substance isolation. Then I perform a primary assessment focusing on airway, breathing, and circulation. I check for life-threatening injuries, control major bleeding, and stabilize the cervical spine if needed. Next, I conduct a rapid head-to-toe exam to identify additional injuries. Throughout the process, I monitor vital signs, reassess frequently, and communicate findings to my partner and the receiving facility. My priority is ensuring rapid, safe, and systematic care. 9. Explain the importance of teamwork in EMS. Teamwork is essential in EMS because emergency scenes require efficient communication, coordination, and trust. Each team member plays a crucial role, whether operating the equipment, providing patient care, or ensuring the scene is safe. Good teamwork prevents mistakes, improves patient outcomes, and increases overall efficiency. When partners understand each other's strengths, they can split tasks effectively and handle complex situations smoothly. Teamwork also helps manage stress, maintain morale, and create a safer working environment for everyone involved. 10. How would you handle a combative or aggressive patient? I first ensure my own safety and assess the environment before approaching a combative patient. I use calm, non-threatening communication to de-escalate the situation and identify triggers. If possible, I try to build rapport and offer reassurance. If the patient becomes a danger to themselves or others, I follow protocols for restraint, notify law enforcement if needed, and prioritize safety. I maintain professionalism at all times and document the incident thoroughly. De-escalation, communication, and safety remain my top priorities. 11. How do you stay organized during emergency calls? I stay organized by following a consistent assessment sequence, communicating clearly with my partner, and prioritizing tasks based on patient needs. I prepare equipment ahead of time, keep supplies stocked, and maintain a clean ambulance. During calls, I focus on one step at a time while staying aware of changing conditions. I also use checklists and established protocols to avoid missing key details. After each call, I restock equipment, complete documentation promptly, and prepare for the next run. 12. How do you handle emotional family members on scene? I remain calm, compassionate, and patient when dealing with emotional family members. I acknowledge their concerns and reassure them that we're doing everything possible to help. I also provide clear, simple explanations about what we're doing to avoid confusion. If necessary, I gently ask them to step aside to give us space to work safely. Maintaining respect and empathy helps reduce tension and keeps the focus on patient care. 13. What would you do if your partner made a mistake? If my partner made a mistake, I would address it professionally and immediately if it affects patient safety. I would calmly correct the error without placing blame or escalating the situation. After the call, I would discuss the issue privately, focusing on improvement and teamwork rather than criticism. I believe in open communication and continuous learning. If the mistake involved a serious violation, I would follow organizational reporting policies, but my goal is always to support my partner and ensure safe, high-quality care. 14. How do you handle witnessing traumatic or emotional scenes? Witnessing trauma is challenging, but I manage it by staying focused on my responsibilities and maintaining emotional control throughout the call. I remind myself that my role is to provide care and remain calm for the patient and my team. After the call, I take time to decompress, reflect, and participate in debriefings if available. I also practice healthy coping strategies such as exercise, talking to mentors, or using peer support programs. Managing emotional stress is essential to long-term success in EMS, and I prioritize mental wellness to maintain professionalism and resilience. 15. Describe the steps you take when responding to a cardiac arrest. During a cardiac arrest call, I begin by ensuring scene safety and immediately checking responsiveness and breathing. If the patient is unresponsive and not breathing normally, I start CPR and request additional resources. I apply an AED or monitor as soon as possible and follow the prompts for shock delivery. My partner and I rotate compressions every 2 minutes to prevent fatigue. I establish airway management, provide ventilations, and gather information from bystanders. Throughout the response, I maintain effective communication, provide high-quality compressions, and prepare the patient for rapid transport if ROSC is achieved. 16. How do you manage multiple patients in a mass casualty incident, MCI? In an MCI, I follow the START triage system or the protocol required by my agency. I quickly assess patients using simple criteria such as breathing, perfusion, and mental status. Patients are tagged according to priority: immediate, delayed, minor, or deceased. I focus on treating the most critical patients first while making rapid decisions. Communication with incident command is essential to coordinating resources and ensuring order. My goal is to maximize survival by prioritizing patients based on severity and helping create an organized, efficient emergency response environment. 17. How do you communicate effectively with patients who are anxious or panicking? I use a calm, steady voice and maintain reassuring body language to help anxious patients feel safe. I acknowledge their fear and explain what I'm doing in simple terms to reduce uncertainty. Active listening helps me understand the cause of their anxiety and respond appropriately. I encourage slow breathing and offer reassurance throughout treatment. By remaining patient, compassionate, and professional, I create a sense of trust that helps the patient regain control and cooperate more effectively during care and transport. 18. What is your approach to lifting and moving patients safely? I follow proper body mechanics to prevent injury to myself and my team, using my legs instead of my back, keeping loads close, and avoiding twisting motions. Communication with my partner is essential. We agree on commands and coordinate movements before lifting. I assess the scene and choose the safest equipment such as stretchers, stair chairs, or backboards. If a patient is too heavy or the environment is unsafe, I request additional help. My focus is always on safety, preventing injury, and ensuring the patient is moved smoothly and securely. 19. How do you prioritize tasks in a fast-paced emergency? I prioritize tasks by using the ABCs, airway, breathing, and circulation, as my foundation. Life-threatening conditions always come first. I also consider scene safety, patient condition, and available resources. Communication with my partner helps ensure we divide responsibilities effectively. I focus on one critical task at a time while staying aware of the overall situation. By following a structured assessment and relying on training, I prevent overwhelm and maintain control of the scene. Prioritization ensures efficient care, safety, and better outcomes for the patient. 20. What would you do if you disagreed with your partner about patient care? If I disagreed with my partner, I would stay professional and discuss the concern calmly, focusing on what benefits the patient most. I would reference protocols, training, or medical control guidance to support our decision. If the disagreement cannot be resolved immediately and the situation is critical, I prioritize patient safety while following established procedures. After the call, I would revisit the conversation privately to understand each other's perspectives and prevent future conflicts. Respect, teamwork, and clear communication guide my approach to resolving disagreements. 21. How do you ensure accuracy when completing patient care reports, PCRs? I ensure accuracy by documenting information as soon as possible after the call so I don't rely on memory alone. I include vital signs, assessments, patient statements, treatments, timelines, and observations. I double-check spelling, numbers, and medical terminology to maintain clarity and professionalism. PCRs must be complete, objective, and compliant with legal and agency standards. Accurate documentation protects the patient, the crew, and the department while providing valuable information to hospital staff. 22. How do you handle situations involving children or pediatric emergencies? Pediatric emergencies require calmness, empathy, and careful assessment. I use age-appropriate communication to build rapport and reduce fear, speaking gently and clearly. I rely on pediatric assessment tools like the PAT, Pediatric Assessment Triangle, and adjust equipment and medication doses based on weight. I involve the parent or guardian when appropriate to help soothe the child. I remain extra attentive to subtle signs since children may not communicate symptoms clearly. Compassion, patience, and strong clinical understanding are key to handling pediatric emergencies effectively. 23. What would you do if you arrived at a scene that felt unsafe? If a scene feels unsafe, I do not enter until it is secured. My safety and my partner's safety come first. I observe from a distance, request law enforcement if necessary, and communicate with dispatch about potential hazards. Entering an unsafe scene puts everyone, including the patient, at greater risk. Once the scene is declared safe, I proceed with caution, maintain situational awareness, and continuously reassess for new dangers. Prioritizing safety ensures we can deliver effective care without becoming victims ourselves. 24. How do you stay current with EMT skills and medical knowledge? I stay current by attending continuing education courses, participating in hands-on training, and reviewing updated EMS protocols and guidelines. I regularly practice skills such as CPR, airway management, splinting, and patient assessments. I also learn from real-world calls, peer discussions, and feedback from supervisors. Staying informed about new equipment, procedures, and best practices helps me improve my performance and provide high-quality care. EMS is constantly evolving, so ongoing education is essential to staying competent and confident. 25. Why should we hire you as an EMT? You should hire me because I'm committed, hardworking, and passionate about providing excellent patient care. I bring strong clinical skills, solid training, and the ability to stay calm under pressure. I work well in teams, communicate effectively, and maintain professionalism in challenging situations. I'm eager to learn, dedicated to continuous improvement, and motivated to contribute positively to your department. My goal is to provide compassionate, efficient, and reliable service while upholding the highest EMS standards. Thank you for watching. I hope these top 25 EMT interview questions and answers help you feel confident, prepared, and ready to succeed. EMT interviews can be intense, but with the right preparation, you can stand out and show your passion for helping others. If you found this video helpful, make sure to like, share, and subscribe for more career-boosting content. Good luck on your EMT journey. You've got this.